been up a check, I might do it again. Enemies close, have me thinking they're friends. 10 toes down, I'll be free until the end. Crib outside the city.
If you are a caregiver or someone who looks after elderly patients, you know that communication is key. It's the foundation of trust, understanding, and ultimately, the best possible care. But let's be real. Talking to seniors can sometimes feel like you're navigating a whole different language. Especially if they have hearing loss, dementia, or difficulty expressing themselves. It can be a challenge, right? But trust me, it doesn't have to be. In this video, I'm going to share some practical tips that I've learned over the years working with patients. Tips that will help you break down those communication barriers, build stronger connections, and provide the best care possible. Let's get started. Alright, tip number 1 might seem obvious, but you'd be surprised how often it's overlooked. Speak clearly and slowly. Imagine trying to understand someone speaking a mile a minute in a muffled voice. Frustrating, right? That's what it can feel like for someone with hearing difficulties. Now, I'm not saying you need to shout. In fact, shouting can be counterproductive, making someone feel like they're being talked down to. Instead, raise your voice slightly, just a notch, and speak at a pace that allows your words to really sink in. Think of it like this. You're having a conversation, not a race. A calm, measured tone can make all the difference in helping someone feel comfortable and heard. And isn't that what we all want? To feel heard and understood? Remember, communication is a two-way street. It's about sending and receiving information effectively. By slowing down and enunciating clearly, you're giving the other person the best chance to understand you. And here's a little bonus tip. Before launching into a complex topic or instruction, try starting with a simple question like, "How are you feeling today?" Or "Did you have a good night's sleep?" This helps establish a connection and ensures they're ready to engage in conversation. The key here is patience and empathy. Put yourself in their shoes. A little understanding goes a long way in building a strong and trusting relationship. So, speak clearly, speak slowly, and watch how this simple adjustment can transform your communication. Tip number 2 is all about the words we choose. It's about keeping things simple and respectful. Now, you might be tempted to use technical medical jargon, especially if you're explaining a diagnosis or treatment. But trust me, that's a recipe for confusion and anxiety. Instead, opt for plain everyday language. Think of it as having a conversation with a friend or family member. You wouldn't use complicated medical terms with them, would you? Keep your sentences short and to the point. Break down complex information into smaller, more digestible chunks. And if you're unsure whether they've understood, don't hesitate to ask. Now, simplicity doesn't mean talking down to someone. It's crucial to always maintain a respectful tone. Remember, you're communicating with an individual who has lived a long life, full of experiences and wisdom. Instead of saying, "You need to take your medicine now," try something like, "Would you like to take your medicine now?" See the difference? It's a small change, but it makes all the difference in conveying respect and giving them a sense of control. Respect their opinions, even if you don't agree with them. Listen attentively and acknowledge their feelings. Remember, everyone wants to feel valued and respected, regardless of their age or health condition. So, ditch the jargon, embrace simplicity, and always communicate with respect. Now, let's talk about the unspoken language, the kind that speaks volumes without uttering a single word. That's right, we're talking about nonverbal communication. You see, communication isn't just about the words we say, it's also about how we say them. Our body language, facial expressions, and tone of voice all play a crucial role in conveying our message. When interacting with elderly patients, maintaining eye contact is paramount. It shows that you're present, engaged, and genuinely interested in what they have to say. Think about it. When someone avoids eye contact, it can come across as dismissive or disinterested, right? But when you maintain eye contact, it creates a sense of connection and trust. It shows that you're listening, not just hearing. And trust me, that makes all the difference. Now, eye contact is just one piece of the puzzle. Your facial expressions are equally important. A warm smile can instantly put someone at ease, while a furrowed brow might signal frustration or concern. And don't underestimate the power of a gentle touch. A reassuring hand on the shoulder or a pat on the back can convey empathy and support in a way that words sometimes can't. Think about your own experiences. How do you feel when someone is genuinely happy to see you? You feel valued, right? You feel seen. That's the power of nonverbal communication. So remember, while words are important, Don't underestimate the impact of your body language. Maintain eye contact, offer a warm smile, and use touch appropriately to create a comfortable and trusting environment. Let's face it, in today's fast-paced world, patience seems to be a virtue in short supply. But when it comes to communicating with elderly patients, patience isn't just a virtue, it's essential. Remember, they might process information differently or take a little longer to respond. And that's okay. We all have our own pace. Instead of rushing them or finishing their sentences, give them the time they need to express themselves fully. Let them know that you're there for them, without judgment or interruption. Active listening is crucial. It's about truly hearing and understanding what the other person is saying, not just waiting for your turn to speak. Put away your phone, silence those notifications, and give them your undivided attention. Make eye contact, nod your head to show that you're following along, and offer verbal cues like, "I understand," or "Tell me more," to encourage them to continue sharing. And here's a little secret. Sometimes the most powerful thing you can do is simply be present. Sit with them, even in silence. Your presence alone can speak volumes. Remember, patience isn't just about waiting, it's about understanding. It's about meeting people where they are and giving them the time and space they need to communicate effectively. Let's be honest, we've all been there. You hear something important, you tell yourself you'll remember it, and then poof, it vanishes into thin air. Now imagine experiencing that on a regular basis. That's the reality for many elderly patients, especially those dealing with memory issues. That's where visual aids and written notes can be game changers. They act as memory anchors, providing a tangible reminder of important information. Think about it. If you're explaining a medication schedule, instead of just rattling off a list of times and dosages, write it down. Create a clear, easy-to-read chart with the medication name, dosage, and time. You can even use different colored pens to highlight specific instructions. Visuals are incredibly powerful. If you're explaining a procedure, consider using diagrams or illustrations. A picture is worth 1,000 words, right? And don't underestimate the power of simple gestures. If you're asking someone to take a pill with water, point to the pill bottle, then to a glass of water. It might seem obvious, but these visual cues can make a world of difference. The key here is to keep it simple and consistent. Use large fonts, clear headings, and avoid clutter. Remember, you're aiming for clarity and ease of understanding. So, ditch the mental gymnastics and embrace the power of visual aids. Now, here's a universal truth. No two individuals are exactly alike. We all have our own unique quirks, preferences, and communication styles. And that's especially true for elderly patients. One size fits all? Not a chance. So, ditch the one-size-fits-all approach and embrace the beauty of individuality. Take the time to get to know each person you're caring for. What are their likes and dislikes? What are their communication preferences? Do they prefer direct eye contact or find it uncomfortable? Observe their body language and adjust your approach accordingly. For example, if someone is hard of hearing, make sure you're facing them directly when you speak. Speak clearly and at a slightly slower pace, allowing them time to process your words. For those with vision impairments, describe your surroundings, announce your presence as you enter a room, and use a gentle touch to guide them. And if someone is experiencing cognitive decline, use simple, concrete language. Avoid using sarcasm or figures of speech, as they can be easily misunderstood. The key is to be adaptable, flexible, and always patient. Remember, it's not about you, it's about them. We've covered a lot of practical tips, but here's the most important one of all. Show empathy and compassion. You see, at the heart of every interaction, every conversation, is a human being. A human being who deserves to be treated with dignity, respect, and kindness. Elderly patients, especially those facing health challenges, might be feeling vulnerable, scared, or even frustrated. They might be missing their loved ones, their independence, or simply the way things used to be. Imagine yourself in their shoes for a moment. How would you want to be treated? You'd want someone to listen to you, to validate your feelings, and to treat you with compassion, right? So the next time you're interacting with an elderly patient, take a moment to step into their world. Acknowledge their feelings, even if you don't fully understand them. Offer a listening ear, a comforting touch, or a kind word. Remember, sometimes the most powerful words you can say are, "I understand." Even if you haven't walked in their shoes, you can still acknowledge their feelings and let them know that they are not alone. At the end of the day, it's about human connection. It's about reminding each other that we're in this together. Good communication can make a huge difference in caregiving. It helps build trust, reduces stress, and improves the quality of care you provide. Remember, communication is a two-way street. It's about listening just as much as it is about speaking. So, be patient, be present, and most importantly, be kind. If you found these tips helpful, don't forget to like, share, and subscribe for more caregiving advice. Let me know in the comments, what challenges do you face when communicating with elderly patients? Thanks for watching, and I'll see you in the next video.